Well, if you can do hyperbaric oxygen before any insult, it turns out it has an effect that's called preconditioning. And what you do through gene expression and other effects is kind of strengthen the person for the insult that then occurs. And if you do it, right before, generally within the previous 24 hours, what it's been shown to do is inhibit those white blood cells that you're inhibiting right afterwards, if you did a hyperbaric treatment right afterwards. So you can knock out those white blood cells for almost 24 hours with a treatment, 1-2 treatments right before. And now, the surgery happens, surgical trauma, anesthesia effects, toxic effects of the anesthesia. And what you're inhibiting is then the body's reaction to that because you've knocked out those white blood cells. But the other part of it, and the reason that you want to couple it with doing it afterwards, you can't knock out all the pathology. I mean, any surgery, a cut, it's significant trauma. Plus they bovie, electrocautery, depending on extremities, they'll tourniquet it, completely shut the blood supply off for the leg while they work on arteries, reset a bone, put screws and plates in, do other things. And what happens is that's a huge amount of trauma. And part of that inflammatory reaction is, due to the white blood cells and other effects, the blood vessels dilate. When they dilate, they leak liquid. That gives you the swelling after, think of it, any sprain, any surgery, any trauma. Hyperbaric oxygen, like there is nothing in medicine that can equal it, treats the swelling. And it does so by simple osmotic effect. So, post surgery, you're treating not only that inflammatory reaction, but you're treating the results of that inflammatory reaction and primarily swelling.